Hello, and welcome to the University of Utah's Cardiopulmonary Physical Therapy Residency Information Session. My name is Emma Johnson, and I'm the Program Coordinator. Thank you for joining me and learning more about our program. Over the past several years, the opportunity to participate in a residency program has grown. As of 2023, there are now 12 accredited cardiovascular and pulmonary residency programs and one more program awaiting accreditation. So why choose residency? Residency is a unique learning opportunity designed with the sole purpose of giving one exceptional resident the absolute best experiences we have available to help grow their clinical skills, professionalism, and knowledge so they can be the best clinician possible in their area of specialty interest. We foster an environment where the primary focus is on your learning, and we support this through extensive educational opportunities and mentorship that non-residents do not receive. Our hope is that we provide you with the skills, knowledge, and experience to set you apart from the other thousands of DPTs out there. Our goal at the end of your residency is that you will feel well prepared to do more than just practice, but to also teach, become involved in research, and engage your community to advance and elevate our profession. On the flip side, what's in it for us, your leadership and mentoring team? Why do we donate our time to helping a resident become an expert clinician? It's because we all believe in progressing our profession and supporting those who want to advance our practice. Additionally, the most common feedback from mentors is that having a resident inspires them to continue learning and help grow their contribution to the advancement of PT. Why cardiopulmonary PT? Cardiovascular disease is a leading cause of death and disability in our country. Unfortunately, education on the management of patients with this disease is not a main area of focus in many DPT programs, and residency can help fill the gap in knowledge. There is also a lack of internship opportunities in cardiopulmonary settings, especially in critical care. Despite this, there are increasing job opportunities and awareness, as well as a growing body of research in cardiopulmonary PT, thus a huge opportunity to improve our current practice. Our program has been accredited since 2022. It is 12 months long, and we take one resident per year. Our mission is to provide qualified physical therapists with advanced knowledge and clinical skill in the management of individuals with cardiovascular and pulmonary impairments. Because we take just one resident per year, this allows us to individualize our program to best meet your unique residency goals. Our primary rotations include inpatient, outpatient, adult, and pediatric settings. Our residents receive intensive mentoring with close to 200 hours of one-on-one mentoring with our highly skilled and specialized clinician mentors. Our residents become employees of the University of Utah Hospital and Clinics for the duration of the program with full benefits and compensation. Additionally, we provide opportunities for observations in surgical, interventional, and testing procedures in various settings for experiencing the whole picture of cardiopulmonary care. Our program leadership consists of myself, our program director, Haley Bento, and our clinical director at the hospital, Chris Noren. Our mentors already practice in a team-based model, which supports specialization of their practice. The mentors that you will work with on each unit already spend the majority of their time practicing on that unit. Currently, we have one board-certified mentor, with one more awaiting the results of the 2023 examination. Our program consists of all the components listed here. The expectation is that the combination of all of these elements will create a full-time or slightly more than 40-hour per week commitment. It's important to remember that the goal at the end of the year is that you will be practicing at specialist level, and that requires hard work and dedication to all of these pieces. Each of these components can be developed further past the minimum requirement depending on your specific interest and residency goals. Our schedule features both inpatient and outpatient units, as well as acute and critical care floors, with about 20% of your time spent in outpatient clinics and about 50% of your time spent in ICUs. We're on Instagram, so follow us at Utah Cardio PT Residency. Our Instagram features what our mentors, our current and our previous residents are up to, as well as additional information about our program. Here's an example of what the first half of your residency year might look like. As you can see, we have didactics specific to the rotation that you're on, as well as teaching and other experiences to further support your learning within that specific rotation. And here's an example of what the second half of your year might look like. As I previously stated, you'll spend about 6 months in our ICU settings on our medical or our pulmonary ICU, and then our cardiovascular ICU. Our didactics include online webinars through PT CardioEd and MedBridge, in-person courses like our ICU nursing education, as well as our in-house education series like our therapy grand rounds, and then certifications and trainings in advanced cardiac life support, durable and temporary VAD training, and level 1 or level 2 APTA CI credentialing. We're very fortunate to have a strong relationship with our nursing educators. As part of your didactics, you will take some of the ICU education courses that are required of our ICU nurses. We hope this will not only further your learning, but also provide you with a greater understanding of the expertise that our nursing colleagues possess and encourage you to learn from them. Gaining experience in teaching is essential to helping you develop as a resident. One of the best ways to test your understanding of a subject is to teach it to others. We provide opportunities for you to teach within our DPT Cardiopulmonary Management course as a lab assistant, as well as a handful of lectures, in our doctoral seminars, which is education in small groups with a focus on critically appraising and applying research, as well as nursing education and staff in-services, such as our therapy grand rounds. Additionally, we hope that your involvement in teaching DPT students will help inspire them to pursue specialization and residency participation. One of our favorite teaching experiences amongst both mentors and residents is our ICU simulation lab for the first-year DPT students. Each year, we have a case-based lab to provide hands-on experience and real-time clinical decision-making in a safe setting for our students to learn what it's like to work in the ICU. We also offer a wide array of interdisciplinary days to learn from those who know it best. You'll have the opportunity to learn from surgeons and OR nurses in cardiac surgery, as well as the cath lab, to learn about ventilators and other aspects of respiratory care from our respiratory therapists, as well as learn from our ICU nurses, our occupational therapists, all the members of our VAD team, and all the members of the cardiology and pulmonary clinics. Here's an example of when our resident was able to observe in cath lab. We're always open to setting up new observations for you if there are certain aspects of cardiopulmonary care that you think would be beneficial to help further your learning. We also want residents to be able to give back to the community and be involved in outreach. We hope that service is a central theme of residency year and provide an array of service opportunities, some of which are listed here. We have a research requirement for residents and keep the terms of it pretty broad to allow for your interest and creativity to flourish. Our PT team always has some ongoing project that you can become involved in, or you can work to develop your own. Delivering in-services to staff is another requirement of our residents, and similar to the research requirement, we want your curiosity to shine. At any point during your year, if you develop a clinical or process question and explore the how and why, we want you to share what you've discovered to help all of our staff learn and grow. Also, we love teamwork. In previous years, our residents have collaborated on in-services. This specific post features an in-service on lab values led by our cardiopulm and acute residents. So what sets us apart? As I've already stated, we have extensive outpatient clinic experience opportunities as well as acute care opportunities to provide you with an in-depth understanding of the entire care continuum for our patients. We are a level 1 trauma center that has been a top 10 hospital in quality for the last 13 years. We have ECMO, VAD, and transplant programs. We are a teaching hospital, which not only provides us with opportunities for research involvement, but also creates a culture of learning, not only within the therapy department, but across interdisciplinary teams. We have a close relationship with the DPT program, and we have an excellent understanding of work-life balance with unmatched access to recreate in the beautiful landscape around us. Here's a visual of where you will be working and living as a part of our residency program. The yellow star is where our hospital is within the Salt Lake Valley. 5 minutes out the back of the hospital, and you can be on the trails in the foothills of the Wasatch Mountains. And within a 30-minute drive, you can be in the mountains, hiking, biking, running, and skiing. We have a starting salary seen here, which is fully benefited and at the 0.75 full-time equivalent. It is also dependent on the amount of practice experience you have prior to residency. Additionally, It includes educational funds for continuing education and conference attendance. We also have a program fee, part of which covers your subscription to PT CardioEd and MedBridge. Other costs include uniform requirements, a personal liability policy, and membership to APTA as part of the Cardiopulmonary section and Utah chapter. Applications are submitted through PTCast and are due February 15th. Interviews and notification to applicants occurs in early March, and our program begins in August. Upon successful graduation of the program, residents will qualify to sit for the Cardiopulmonary Specialty Board exam the spring following graduation. Thank you so much for your attention and your interest in learning about our residency program, and I look forward to meeting you at a future meet and greet session.